This conference will now be recorded.
There we go. Perfect. So now we've got the preliminaries out of the way. I'm going to introduce the first two of our four presenters this morning. They're going to do a bit of a tag team here, and after they're done, we'll save our questions again to the end, and then we'll have our other two speakers shortly after that. So first, I'd like to introduce Craig Fraser. Craig is the Chief Experience Officer and Chief Operations Officer for Safety Tech, a company he founded with his business partner, Ryan Quiring, in 2014. What they have created is a cloud-based safety platform specifically designed to meet the needs of corporations and industry. Our speaker who's going to get things kicked off here is Ernest Kremers. Ernest is the owner of Kremers Safety Limited. Kremers Safety Limited is a safety consultant organization that helps companies across Canada with safety compliance, certification, implementation, and management of safety systems and safety training programs. Ernest has been a safety consultant for 18 years and a contract instructor for the Alberta Construction Safety Association for 8 years. Ernest, thanks for joining us today, and if you're just patient with me, I will hand over presentation control to you.
Thank you very much. Good morning, everyone.
Ernest.
So everyone is here. I will share my screen and we should be good to go. So welcome, everyone. Really pleased to be here. It is a privilege. So it's not about me, it's about what's happening in our industry at the moment. So first of all, I want to give a great big shout out not only to BILD for us being able to get together to communicate, but also to those that are part of the essential services in our communities where we live, both health personnel, police officers, firefighters, all the EMTs, construction workers, etc. A lot of us have gone into isolation due to the fact that we are now in a new normal. And the situation is this, that we're now dealing with virtual meetings. There's three catchphrases now that are becoming very popular: social distancing, social distancing, community transmission, and of course, the word PPE is now banned all across the world. Just a quick update. I did some homework last night. Canada has now 16,667 confirmed cases. Alberta has got 1,348, and in the Calgary region, we have 60.6% of the cases in Alberta, and in Edmonton, 26.1. So this came from Health Alberta last night. So these are the process. Also, what's very startling at the moment is that as of March 30th, we had an Angus Reid poll come out where it stated then, and I looked for information to see if there was any updates, but there weren't. So this is the latest information that 1 out of 8 Canadians think that the COVID-19 crisis is overblown. We have some work to do. So today, what I'd like to talk about is these key points. We want to talk, we've got a personal account that I just want to touch base on quickly. Some of the challenges the employers are facing. We want to talk about specific site prevention procedures. We're going to talk about a little bit about stress of workers and subcontractors and what could future projections look like. So business challenges. Personally, we had 2 individuals of our organization through no work-related process with our company, but personal community transmission, get the COVID virus, and they are doing well. They went through it, recovered, but we made the decision in early March to shut everything outside of our offices down due to the fact that we have the opportunity to really transmit. So we stopped that. And we are absolutely looking at social distancing inside our own organization. So we're working from home and we're doing our best. But we also had to lay some people off, both in employees and subcontractors, and that's not fun. And a lot of organizations are looking at this stuff on a daily basis to see where they're at. So the fact that the construction industry is still an essential service is amazing. It's terrific, but it requires some challenging and it requires some oversight. Now, and this is what I wanted to talk about a little bit: contract obligations, both from the general contractor, prime contractor. There are obligations that need to be fulfilled by all. Okay. Economic. We're all concerned what's going to happen.
Ernest,
Yes.
Ernest, just hang on a sec. I'm going to mute everybody's mic here.
Okay.
Just one here. Okay, and then you'll have to unmute yourself there. All right, try again there, Ernest.
Okay, so all of us are concerned with the economy. All of us are concerned with the economic situation, not only today, not only 2 months, but what does it look like for the next 2 years? And we'll have a very quick discussion on that, what some thoughts are. Health and safety is being impacted greatly at this moment. There's lots of new protocols that have to be in place because of COVID-19. Dr. Ian Wheeler is going to give some specifics on those. On the personal side, I would like to talk about some health and safety processes that may be useful to you. But all of these things affect production and quality because social distancing, specific protocols, sanitizing, and those kind of things. So we'll take a look at those, and so that we can move forward and still be productive. All right, hang on. So I would like to hand it over to Craig, as he's got his site assessment process available for us. And I think that's a great place to start prior to moving forward.
Thanks, Ernest. Just stand by for a sec, Craig.
Sure.
Apparently you get to stand by for my computer. It's just working a little slower today.
There we go.
Now?
Should be good to go. Awesome. Well, thanks. Good morning, everybody. My name is Craig Fraser with Safety Tech. Same thing, Ernest. Great lead off there. I just wanted to thank BILD Calgary for letting me present today. What I wanted to discuss today is Safety Tech's free COVID-19 self-assessment Safety Tech initiative. What we did is we saw an opportunity for us to help as an organization, obviously with construction being deemed as an essential service. Me and my team are from the construction space, and we wanted to do whatever we could in order to ensure the ongoing health and safety of the workers that are deemed essential, right, and are still out there every day, keeping the world running right now. Okay. So I just want to start a little bit about what Safety Tech is. There was the small introduction. So we are a safety engagement platform designed to deploy companies' safety programs digitally, where workers have access to their documentation. They can fill out and submit that documentation directly into management, where our system takes care of the administrative process and then provides the critical safety data, allowing managers and executives to make safety decisions based on actual data, and we do track all that in real time. Okay. As mentioned, I am one of the co-founders. I do come from the construction space. I did about 12 years in industrial and commercial construction. Got into safety as well, and then kind of, as a company, kind of saw the gap in the process of, the daily paper processes, emailing type process that safety coordinators or safety managers deal with, and we wanted to fix that problem or make it more efficient. I was born and raised in Calgary. I worked on some of the biggest projects in the city during kind of my time. And our system is currently running about 5,000 plus daily active users. Okay. So just as a little bit of a warm up, just a little bit of a background. So what we're really doing with COVID, as I mentioned, we did see this opportunity to help. What really triggered us was when the World Health Organization deployed the self-assessment form. Because we digitized company safety programs anyway, we're like, hey, what can we do with this? So we ended up actually pausing our current development cycle. We brought the whole team in as kind of an all hands on deck. What can we do to help? So we kind of sat and we brainstormed some ideas of, if we can get this form and we can deploy it, what kind of data can we pull or can we unlock from that form that would be, pertinent to obviously, managers and people that have to monitor the ongoing health of their workers. So we essentially created this deployment or deploying this form, as well as a dashboard, a data dashboard, specifically designed for COVID-19, which I'll show you here. So we did release this March 23rd, and I think we have about 90 companies already using this free version, okay? So a little bit about what it looks like. So anyone that registers for the COVID-19, what our system does is it automatically deploys this COVID-19 self-assessment form based on whoever you invite in the registration. Okay, so everything's handled for you. It'll automatically deploy it. Workers can simply go, they're very simple yes/no questions based on the World Health Organization form. Okay, obviously the self-assessment can be completed, as many times as your company wants. We recommend daily, at least, so we can actually track the trend of the health of, or track the health over time. Okay, we have some companies that are submitting more than that, just because they want to see more data. Okay. So a little bit about, pardon me, about what the dashboard shows. So this would be for management. So it will actually show the total amount of workers that are currently on this, any other pending invitations that you've sent out. It will show how many submissions of the form will be there and how many responses that we've had. As you can see, the data table there will actually then track the self-assessments per day, which then can be highlighted and accessed. Those forms can actually be accessed and viewed, okay? And then we do track the form responses as well. So in the bottom left corner, we'll see our graph. So obviously with this form, the yes questions are the ones we want to pay attention to, okay? If everything's no, everything's good, okay? Anything with yes, we'll track, we graph, and also on the table to the right, we can actually see the users that have answered yes to those questions, okay? So by clicking on, say, our 4 users said yes to 2 health questions, we'll actually populate those 4 workers and allow us to directly email them. So a perfect way for us, as I mentioned, just to track this ongoing health of our workers. If anything does change, we're going to know in real time based on the self-assessment form, so managers and supervisors can make those decisions, okay? And that whoever's healthy can continue to work. And we want to make sure that we're doing whatever we can to keep these projects open. Okay. Also, along with the deployment of the COVID-19 self-assessment form, as well as the dashboard, we do have a content delivery system that's native to our system right now, and we are providing that for free as well. The idea behind this is our content delivery system essentially takes anything that you put into it and dispenses it or disperses it to your workforce, okay? So with all the changes to COVID and all the updates that are happening, it seems things are changing by the minute or by the hour. We want to make sure that this information is being sent out and that we are acknowledging that the workers are actually digesting this. So our content delivery system we can push through, and it will actually track opens, unopen rates, and actually who's viewed the document and the time on the document as well, okay? So that we can make sure, like I said, that they are actually acknowledging this stuff, because we want to make sure this stuff's really important right now. As the changes keep seeming to happen every minute, we want to make sure that our workers are up to date with those changes. So as I mentioned, all of this is completely free, offering for Safety Tech. If you are interested in registering, you can simply go to our website at safetytech.io. For direct access to the registration page is safetytech.io/COVID-19, seen here. Okay. I want to thank everyone for the opportunity to speak, and please stay safe out there.
Thanks, Craig. Just give me a second here and I'll get the controller back to Ernest in just a half a sec here. Ernest, you should be in charge.
Thank you very much, Craig. Terrific presentation. Appreciate the fact that it's available to everyone to use, because I think it's so crucial that everything is, as part of our prevention procedures, that the first thing that's looked at every morning is that fit for work. Are people able to continue working without being compromised by the COVID-19 virus? That then segues into hazard assessments. Again, With that, including toolbox meetings, we should look at who is on site, who's going to be on site, what's going to be delivered, and how is that managed to minimize the opportunity of community transmission. That is so important, that who's coming to site, is everybody aware. Now, this could make a challenge for prime contractors, general contractors, employers, as things change on a consistent basis on a construction site. Social distancing at toolbox meeting is crucial. You could do electronic texting. You could have so many ways to communicate in order to minimize that exposure for people. And of course, trades are usually working by themselves these days. With information, first of all, safety absolutes. There cannot be any deviation from the procedures you put into place. With what Brian said this morning, where the media would love to see things not being done correctly so they can put that on the news, which would really be detrimental to the construction process in Alberta. You might want to also have a dedicated person just to manage the information, and through the Safety Tech initiative, that could be very, very effective and minimize the time frame. There needs to be collaboration with all trades on site to make sure that everyone is not congregating in the same area. Staggered breaks. Some people are eating lunch in their vehicles to minimize that exposure. And of course, sanitization is very, very important, including, as Dr. Wheeler will state later, the porta potties. They could be a real area where it could be dirty. So there's going to have to be a system in place where everyone sanitizes that process. Information sharing, as we're doing here with BILD Alberta this morning. There's lots of good government pamphlets, OH&S pamphlets available to assist the education of our workforce continuously with repetition to make sure that the procedures are followed. You're going to have people calling in. They're going to say, I feel compromised today, and therefore I may not be able to make the work, which is going to affect your production. Let's be supportive of that, because it's better to err on the side of caution and minimize that community transmission than to get an extra 8 to 10 hours worth of production. All of a sudden, the workforce of the site is compromised. And of course, that we'll talk about culture and respect and all of that, because that goes both ways, from workers to management and vice versa. A lot of things that is happening: electronic sign in, sign out, emails, where trades are confirming with their prime contractors, GCs, who's going to come on site. And so that minimizes paper. A lot of electronic documentation is happening. There's lots of good systems out there to do even hazard assessments, toolbox meetings, inspections, and such on a e-platform. Reminders not to touch our faces. We have to continuously tell each other not to do that, because it is a pulmonary virus, and therefore that are the routes of access for it. And a lot of companies are also looking at different hiring processes, even stopping hiring, and doing orientations online, such as webinars and such, in order to minimize that contact and compromise spaces. So what are some of the controls? Most of us understand this graphic very, we've talked about this forever: elimination, engineering, administrative combination. So the best way is to stop work and shut down site. And there have been instances where multifamily or multi-trade sites where there has been a suspected COVID-19 exposure, where they've shut it down until they got confirmation that that was not the case. So that's the best way. Engineering, create separate areas, barriers, give specific locations for specific trades. And of course, the administrative as well. We need to train. We need to remind everyone consistently of those procedures regarding COVID-19. There's so much good information out there that we should keep that in the forefront. Of course, PPE needs to be available: gloves, masks, sanitizers, in some cases respirators, dependent on. And of course, we most likely can also use a combination of those controls on site. What do our employees and subcontractors need? First of all, leadership. There has to be a commitment by anyone in management to lead by example in the COVID-19 prevention procedures. There has to be consistency. There have to be clear expectations laid out for those workers, trades, subcontractors, workers on their expected work behavior, and that needs to be held in high esteem. We need to train them, site-specific, company-specific, organization-specific. We also need to support them, folks, because people are stressed. They're worried about their jobs. They're worried about their finances. They're worried about the future. And a question like saying, how are you doing today, may make the world of difference. So soft skills are going to be crucial as well for that support. And then, of course, accountability has to be absolute. And so these are some of the things that need to be looked at. And these are the stressors. A poor culture is going to put people at risk. Remember, we need to respect the refusal of unsafe work. That is not only legislated or enshrined in legislation, but today that has a new meaning, especially in the COVID-19 pandemic that we're dealing with. Social support, it's not just the worker, it's their families. My GM got a cold last week, and the first thing that went through our mind is, and it wasn't part of his work scope, it was personal, did he have COVID-19? It put a lot of stress as an employer. What is going to happen next? And so people need social support. They're also looking at economic security. The government of Canada, kudos, they are putting initiatives into place that are coming online that if you have to lay people off, there's support for them. So you can work with them, assist them to get that completed, to give them that security. And one of the last things that is absolutely not or should not be tolerated is any kind of bullying or harassment to go to work by anyone, including their peers. And that could really affect people from an emotional, mental disability. So what are we looking forward? Quick update. I did some homework on the Spanish flu, which was the last major great pandemic besides SARS, which was more localized. They figure that anywhere from 17 to 50 million people lost their lives, and it affected approximately over 500 million. For those of you that are following CNN and CTV news nets, over 1 million infected confirmed cases. And so those things affect us. Society is shut down, and this COVID-19 situation could last anywhere from 2 to 18 months. And as we're looking into the economic recovery, it may never, and I'm being very careful with that, it's going to be different. And so the best thing that all organizations should look at is being as flexible as possible, cross-trained as possible, lean and mean in order to meet the new model that's coming out and which we don't know about. So what can we do? We need to have clear, positive communication so that we can enhance our cohesion and compliance with COVID-19 prevention. And having conversations with our people is so important. Let them know that we're all in this together. Thank you very much. Truly appreciate being here. And it's a privilege to be able to communicate with like-minded people in our safety industry so that we can continue. Thank you.
Thanks very much, Ernest, and thanks to both you and Craig for your presentations this morning. You've provided us with a wealth of information there and tools that BILD and BILD members can use to ensure their work sites are safe. We're going to turn now to our next speaker, who is contributing for the first time this morning to our conversation and assurance of safety, and that's Dr. Ian Wheeler. Dr. Wheeler is a PhD in pharmacology and toxicology and is certified by the American Board of Industrial Hygiene. And he is also registered by the Canadian Registration Board of Occupational Hygienists. He has been practicing industrial engineering hygiene since 1976. Prior to consulting, he gained experience in regulatory, corporate, and teaching industrial hygiene. Please welcome him this morning, And if you just give me a sec, Dr. Wheeler, I'm going to pass the control over to you here.
So, can you hear me and see me?
We can hear you, and you should now have control.
Which means click on the right screen here. Does that bring the screen up for you?
Not quite yet. If we just have everyone's patience while we get to this, we will get to it. There is a way.
So I'm clicking on the screen, but it doesn't, it just flicks on and off. It doesn't want to stay up.
We'll give it another sec, and then I can put the presentation up on my screen if need be here. If you want, we can make me presenter, and you can talk me through the side clicking there, Dr. Wheeler. Do you want to give that a go?
I guess so. It's a pity we can't do this though. Just wondering what I'm missing over at my end. I've got these three things to press: mic, camera, which are both green, and screen, which isn't, and that won't take it. Let me see, I've got a screen option here.
Why don't you talk me through it? I'll be the presenter, you can be the talker, and then you just tell me when you want me to click.
Okay. Okay, so when I click on mine, I'm going to be advancing through the sequence of things, and you won't see that, right? So you'll have to coordinate and do it at your end, correct?
That's right. So you just tell me when you might want to move forward. So we should, in short order, see your title screen on my computer here. This is always, of course, where technology grabs us here and slows us down. You can you see your presentation fully on my screen?
Yes.
On your screen, rather? Okay.
On
all
my
right.
screen,
So
your screen. Yeah.
I will advance us one click. How does that sound?
Yes. Very good. Let's go another click.
Whoops. That wasn't the click I was looking for.
No, I've lost your screen now.
Are you back?
No.
How's that?
No, same. What I've got is view everyone and nothing else.
Just patience, everyone. How about now?
Got it.
Okay.
Okay, so I'll start now then, Brian.
Very well.
So really, when we're looking at COVID-19, there's no guarantee of protection. It's not like you can go about things and be absolutely protected. Let's move up one, Brian. What we're looking at is basically risk reduction, minimizing the risk. So when you're looking at the things you do to protect yourself against COVID-19 in the workplace, look on it this way. Anything you can do to reduce risk is going to be useful to the overall protection that you have. And there's nothing perfect. Next. So let's have a look at the main routes of exposure. Next. And inhaling large droplets in air, such as from sneezing, coughing, or speaking, has always been one that the health authorities have promoted as being a very important route of exposure. You see this picture of a guy sneezing. You can see the size distribution of those droplets and how far and with what force they go out. Some estimates have a sneeze as going out at 100 miles an hour, coughing somewhat less than that, more like 20 miles an hour and so on. But these things do expel stuff from your mouth and nose at quite a speed, and they travel. And a sneeze, for example, is thought to be able to travel maybe 20, 30 feet, taking that stuff, although diluted, mixed with air as it goes along, towards you. And the health authorities have, up until fairly recently, been saying that it's these larger droplets, which you can easily see in the picture, that are the ones of most risk to infecting you. Things like surgical masks, then I've shown a picture of a surgical mask, should be able to protect against those larger droplets, although not against the very small droplets, which we'll come to a little later. And you can see that surgical mask does not fit very well, either under the chin or over the nose, but it does provide a barrier upon which those droplets can impact. Next. The next main route of exposure is hand contact with face, and the hands may touch a surface that has become contaminated with coronavirus, because someone has touched their face, someone's blown their nose, and they've got it on their hands, and they've just touched that tabletop or that doorknob or handrail, anything like that. And you come along, you touch it, then you inadvertently touch your face, which everyone does multiple times per minute. You may touch around your lips, your nose, or your eyes, all of which can possibly bring in that virus into the body. So these are the two main routes of exposure, and we know that. Next. However, there are some possible routes of exposure in addition to these. Next. Eye contact with the large droplets is another possibility. The eyes are certainly by no means sealed, and you can get bacteria and viruses getting in through the conjunctiva of which surround the eyes. And mainly, it's been thought that these would be the large droplets that are spewed out during a sneeze and a cough. And for that, eye protection, such as safety specs, should provide you with significant protection. You'll notice when you see pictures of nurses and so on, they're wearing very often small face shields. Well, that's an alternative, but we're used to wearing safety glasses on the work site, and those would do just as good, if not better job. Next. The next one has been controversial, and it's called airborne particulate. You'll hear the term aerosol, airborne, aerosol. These seem to be terms that the health authorities use to describe very fine exhaled mist, much, much smaller than those droplets we were talking about. And these are about somewhere between 1 and 5 microns, many of them. There are all sorts of different sizes around that, but this might be kind of the most common size. The only reason I'm giving you these sizes in microns, micrometers, is to compare them with the droplets, which you can see being 100 to 400 are much, much bigger than these small droplets. By the way, 1 micrometer, as I show up here, is 1/1000th of a millimeter. Now, what protects against these airborne mists. Surgical masks may not, partly because they don't seal very well to the face, and partly because these mists are fine enough, they may penetrate through the actual fabric. I would say to a large extent the surgical mask fabric could stop much of this mist, but I think the main thing is that they don't seal very well to the face and this mist can get around. Next, and next again, how to get infected or not to get infected. Let's look at some possible, continue with the possible routes of exposure. And another group are objects. These may be tabletops, railings, handles on doors, clothing. We have talked about them a little bit previously. Just note that low temperatures and hard surfaces favor survival. And that's not your survival, that's the virus's survival. Sunlight reduces the virus's survival. So if it's an outdoor situation, and especially if it's a porous surface like wood or cardboard, you will expect the virus not to survive nearly as long. I got a figure of 24 hours as being the survival time of COVID on cardboard. Well, I'm sure we're going to get all sorts of different numbers come out on that one, but 24 hours. Whereas on a hard surface, it could be 3 days maybe. One of those cruise ships which had COVID on it, they tested the surfaces up to 17 days afterwards, and they still found some RNA, which is part of the virus, on those surfaces. They could detect virus there. Whether or not that virus at that point in time was infectious is another thing. We don't know. And really, how long viruses are infectious on surfaces is still up in the air. But I would say that the more goop you've got with that virus, if it's come out and landed on that surface because someone has wiped their nose and then wiped their hands on that surface, you've got more goop there and your virus may stay active for longer. Next. The fecal route, poop, in other words, is another possible route for transmission of the coronavirus. It has been detected in the stool of infected people, and it is known with different viruses through the ages that fecal transmission is possible. So personal hygiene very important here. You know, you go to the washroom, wash your hands, make sure they're clean. Before you come out, you don't want to touch surfaces so other people might get infected by that route. Next, please. Abraded skin. Now, we've all been told to thoroughly and frequently clean our skin with soap and water, or if you can't find that, sanitizers. Well, guess what? Guess what these things do to your skin? Skin doesn't really like soap on itself too much because it removes the fatty layer that we have on our skin, which protects the skin. Similarly, for the alcohol that's in the sanitizers, they will tend to remove that. They'll dry out your skin. Your skin will become chapped and cracked, especially in cold weather, with the drying effect of cold weather. And you'll wind up with abraded skin, which is known to be more permeable to microorganisms. And that includes bacteria like Streptococcus and Staphylococcus. It may also include coronavirus, although the tendency currently is to think it's not a big deal. Who knows? We found things out that weren't thought to be a big deal, like that, like the aerosols traveling through the air, but now they are thought to be a big deal. Next, please. How much do we need of this virus to get infected? I don't know. I can't find out. The only figures I've seen are on the emission of bacteria during sneezes, and talking about maybe 100,000 bacteria going out in a single sneeze. Well, all I can think is that the dose, in other words, the amount of virus that you get, and by the way, a bacteria and a virus are completely different. I was just using that as an example of how many infectious species could go out in a sneeze. Anyway, if you got sneezed right in your face without any protection from someone that had COVID, I would think that's a pretty high dose. However, if you're standing 10 feet away from someone that's just talking, even though he or she has COVID and doesn't know it, the amount of material you would get that you would breathe in would be far, far less. And perhaps some of the reasons for some people getting mild infections versus very serious infections comes down simply to that dose. A lot of it is also going to come down to how susceptible the person is, if they're infected with anything else, if they've got asthma or bronchitis or a number of other diseases. Next, please. And next. So our own controls. The first control really, and this has been spoken to already, so I won't stay on this, is really to screen workers from coming to site. If there's any doubt, do a self-assessment and pause before you go to site, talk to the supervisor, see what you think. There's lots of sniffles going around. I mean, I can get a runny nose, I have a cough, but you know, lots of things can cause that. Of course, I'm cautious, I'm careful, I'm not going to go out, but you never know. What you mainly are looking for, I think, is a fever and a persistent dry cough. Those two things would give you cause for concern. Next, please. So this brings us to personal hygiene, which is very important. Hand washing. Now, the soap, pretty much any kind of soap, emulsifies the fat on the outside of the virus particle, and it destroys it. It also removes oils on the hands that might harbor the virus, because viruses can stick on things, can stick to surfaces, can stick to fat, lipid, whatever it's called, oil on your hands, and can remain there. But if you wash it off, that physically removes it. But the additional thing about soap is that it also does destroy the virus envelope and the virus falls to pieces. But take note, you got to wash the whole of your hands. Don't just wash little bits of them, because you might leave spaces where you've got virus on some part of your hand. And don't do it for just 5 seconds. Do it for a full 20 seconds. Make sure that you have enough contact time of the soap with the virus to actually destroy it. Because it takes time for these agents to destroy microorganisms. Sanitizing. Now, the minimum I've seen in the literature as to how much alcohol needs to be in a sanitizer to work is 60%. I've seen 60, 62, 70. The World Health Organization talking about 70 to 80% alcohol. Well, that would work fine, but I think the FDA in the States says 62. Now, sanitizers generally, I would say, are less effective than soap, especially when there's grime and or mucus and muck on your hands. So you're trying to get this alcohol-based thing to work its way through all that stuff, get to the virus, kill it. And whereas when you wash, you're washing all the grime off. So then you've got your clean hands, which then, if it's still got virus on, that soap can get to. If you are going to sanitize, do it for a good period of time, say 20 seconds. Keep that active agent in the sanitizing agent on your hands for long enough in contact with the virus that it's going to kill them off. And lastly, and not least, use hand cream. Use it frequently, because if you do get chapped skin, this can let in microbes, especially Staphylococcus and Streptococcus infections, and maybe, who knows, even COVID. Next, please. And next. Another control is ventilation. The more we dilute the air in the space, even though it's got COVID in fine aerosol floating around in the air, and this fine aerosol can stay in the air for maybe 3 hours, maybe half an hour, depends on its size, but a significant period of time. Well, if you can ventilate it, let's say the furnace works in the house that you're working on, maybe run that. You've got windows, you've got doors, as long as it's not too cold, you can keep them open and keep a breeze going through. Next, please. Then respiratory protection, my personal favorite. So we've talked about surgical masks a bit before and the fact they don't seal very well, and they do protect against large droplets that smack right against the front of them. Okay, that's fine. Homemade masks that are now being promoted pretty much work on the same lines, and they would probably provide similar sort of protection. In other words, large droplets. If you want to catch those small aerosol type droplets down to 5 microns, you're going to need something more like an N95 respirator, which, if fitted adequately to the face, can give effective protection against these fine exhaled mists. And the facial seal here is quite important. There are in many different types of N95 respirators, small, medium, and large sizes. Select the right size for you, because that's important. You put a large size mask on your face and you really would fit a small or a medium, you're going to find that large face piece is going to jam up against and underneath your spectacles, likely causing fogging of the spectacles because of blow-by around the nose. You don't want that. So to ensure an adequate fit, what we recommend is fit testing, which can be either qualitative or quantitative, which gives you a number for how well that fit is. We do fit testing. Lots of other companies do fit testing. So if you want that done, you can look that up and contact the right people. Next, please. And again, also take note that there are N99, which are 99% efficient, N100, which are 99.8% efficient, and the R and P versions of these. N means no resistance to oil mist. In other words, it will stop some oil mist, but oily type mist can get through. R and P type respirators are progressively more effective at preventing oil type mist coming through your respirators. I doubt if you're going to worry about that. I would think that N type series masks would do you well. Do you really need to go to an N99 or an N100? No, I don't think so for coronavirus. I'm only mentioning these because everybody talks about N95, and if you go into a store and say, oh, do you have N95? And they say, no, we've been sold out for weeks. Well, maybe nobody's thought about N100s. Bit more expensive, just as good, better protection, why not? Next slide.
Dr. Wheeler, I think we just lost you for a few minutes there. Can you just go back to the slide that's on the screen there that starts also N99 and just start in again there?
Okay. In addition to N95 respirators, there are N99 and N100. They are more efficient than N95s, which basically, N95s, basically their minimum level of efficiency is 95% or thereabouts. Pretty much in the size range of this coronavirus. But N99 masks should give you a minimum efficiency of 99%, and N100, 99.8%. So they're progressively giving you better protection. And the only reason I mention them, not because you really need to use an N99 or 100, because an N95 will do the job, is that you might go into a store and look for N95s and then being out of them say, no, sorry, we don't have them. But maybe they've got some N99s or N100s, which they could give you. There are also R and P types. There are R99, R95, R100, and the same for the P designation. Don't avoid them either. You can use them. The only thing about them is that these R and P types are more resistant to oil mist. It doesn't take away from their protection against the thing you want to protect against. And if they have them but they don't have N95s, get them. Next, I want to talk about disposable N95s versus reusable cartridge N95 respirators. Personally, I favor the reusable cartridge ones because I find them easier to fit on my face. I also find them more comfortable, and generally I get less blow-by around the nose, meaning that they tend to fit me a little bit better. Now, can folks see the picture of me on a little screen? Well, if you can.
We'll have to stop sharing my screen if that's what you'd like there, Dr. Wheeler, and turn the presentation back to you. Or do you want to just carry on and we can come back to this at the end?
Let's do this at the end then. So next, please. So fogging glasses and safety glasses is certainly an issue. I think we've got two different slides up here. Okay. I'm still on one that shows N99.
Gotcha.
Yeah, okay. So fogging glasses can be an issue, especially in cool weather. You don't want to be working around a work site and you can't see through your glasses. You're going to kill yourself. So it's very important, to my mind, to get a respirator that does not do that too much. Now you can assist that. You can help that by using anti-fogging coatings on glasses. Yes, they can help. It's true. But it's best to start off with a respirator facepiece that does not do that. And you may need to try different sizes, different styles, different makes and models to get the best one. All I can say to you is, generally, I find that the disposable respirators, the dust masks, go too high up my nose and push my glasses up and then fog them up. So you want to make sure they don't do the same thing to you. Next, please. And this is not the next overall slide, just the next point. Yeah, there we are, exhalation valve. The difference between many of these disposable respirators and the reusable ones is that the reusable ones have an exhalation valve through which, when you breathe out, your air goes out into the atmosphere again. You breathe through the cartridge filtering material and you breathe out through the exhalation valve. Some, of course, people have suggested the main value of wearing a mask is not to protect yourself, but to protect the rest of the public, so that if you were infected, when you breathed out, it would go through the filter and it would be filtered out and wouldn't get into the outside air. Well, that wouldn't be the case with a mask with an exhalation valve on it. And all of the cartridge type respirators have exhalation valves. Its advantage is it makes breathing easier for you and you don't get so hot inside the respirator. And I find these things much more comfortable. If everyone's wearing a suitable respirator, you don't have to worry. And in addition, be aware that there are some, even of those disposable respirators, that have exhalation valves on them. So do you want an exhalation valve or not? That would be for you to decide. So going to the next slide now. That's it. Now, authorities suggest we do wear respiratory protection. And I don't want to be a conspiracy theorist, because I'm not really, but I think it must be fairly clear that one reason that authorities weren't recommending masks before for everyone was they were a little scared of a run on them. I mean, after all, look what we did to toilet paper. So, and a run on masks did happen, and masks are still short in some places. It's vital that the healthcare workers get them. They have to take priority. So I think when the whole idea of homemade masks came out, the authorities got really happy about this, And they said, oh yeah, wear a mask, but wear your own, because that won't take away from what we need for healthcare workers. Anyway, the last thing I want to say about respirators is this, that whatever you choose, remember the best respiratory protection is the one you actually wear. Don't go to a work site with something that's uncomfortable, that blows by at the nose and fogs up your glasses, and you get hot in. You're going to take it off, aren't you? Well, you're not supposed to take it off, but you're going to want to take it off. Are you going to cheat? So get a respirator that you will actually wear. And if that turns out to be simply a homemade device or something that is a surgical mask that you bought, which won't protect you as well, but you'll wear it, that may actually be a better approach than some more difficult to wear respirators. Okay, so next, gloves. Gloves, they can be fabric, they can be leather, they can be nitrile, there can be lots of other different synthetic materials other than nitrile. Which to wear? Well, fabric gloves give you warmth. How much do they protect if you touch a surface that has the virus on it? They are porous. They shouldn't provide too much protection, but for a while they could provide some. I suppose you can wash these fabric gloves. I'm not sure, I've never done that. And if you do, wash them in detergent, laundry wash them, that should kill the virus that's on them. Leather you can't really wash too well. I've sprayed my leather gloves with Fantastic Spray, which is a cleaning agent, in the hopes that it might kill virus on them, and the gloves seem to bounce back okay. And then nitrile gloves are impervious. If you wear nitrile surgical gloves, you could wear these under leather gloves or under fabric gloves, but you've got to sort out a protocol that you use for when you do different things. I mean, here I am wearing nitrile gloves, let's say, and I touch something. Oh, have I contaminated these now? Well, then I can't touch my face with these gloves. Anyway, I can't. Can I do other things with them, or will I transfer this virus elsewhere? When you go to the porta potty, you've got to have a protocol there for being comfortable that you've done what you do and you've sanitized your hands when you leave, and that you haven't then contaminated your hands again in getting out of the porta potty, touching the handle, that sort of thing. Hold the handle with paper so that doesn't happen. You've got probably all sorts of other methods for doing that. Next point. Training workers on procedures and PPE usage. I think the training part is very important. Keep this, I think, what we're doing here, the town hall, I hope is useful and very important. But you got to, my experience is you've got to keep going with the training for guys, otherwise they forget things. And that's the end of my presentation. This is me. It shows my phone number, our company website, and my email address. If you have a burning need to ask me any questions, please do so. I'm happy to do that. I'm not doing too much right now, so why not? I wish you all a healthy journey through this COVID epidemic, and hope that you just minimize your exposures as best you can. Don't get all stressed. Just don't panic. Minimize exposures through all routes that you can. Thank you very much.
Thanks, Dr. Wheeler. I'm going to stop sharing my screen now if I can figure out how to do that. And share my picture again. There we go. We're going to toss the presentation over to Brenda now. Hang on a sec, Brenda. I'm just catching up here. My computer tried very hard to melt down in the middle of that, so I had to shut everything off. And now I just have to find you, Brenda, in this.
That sea of people?
In the sea of people, yeah. And if you speak up, it actually helps me because then I can see who's
Okay, sure.
talking. I'll just keep talking to me.
Okay, Brian, no problem. Can you find me? In my, uh,
You are in the list here. There's no question about that. It's just
definitely there for sure.
yes, I just have to find you in the list here. It's gracious. I saw you earlier.
Do you want me to get
Patience,
started,
everyone.
Brian?
Pardon me?
Should I just start while you're looking and then I'll get to the slide in a
Yeah, why
moment?
don't you start here?
Okay,
Yep.
okay. So thanks for having me, Brian, and BILD. I'm Brenda Desjardins. I'm the Director of Calgary Building Services. And I am very pleased to be here with you today to share how, the steps that we are taking at the city to support the construction industry.
There you
So
go,
as
Brandon.
Oh, perfect. Thanks, Brian. As Brian mentioned, and the presenters previous to me, construction safety is extremely important in this time. We know that, Ontario recently, I'm sure I believe it was already mentioned at the beginning of this presentation, but on Friday, Ontario announced steps that were driven by worksite safety concerns that were reported up through the government. And the steps they announced were that they were stopping unnecessary industrial construction, no new residential construction is allowed to begin, and higher scrutiny of open construction sites. So we want to make sure here in Alberta that we don't face that and we can continue with construction as seen as an essential services. So we're all working behind the scenes to advocate both with our municipal governments and provincial governments to keep construction as an essential service. But we can't stress the importance enough that, at every single construction site, that all the safety protocols are followed, because as it was mentioned earlier in the presentations, that the media will jump on any story that there's unsafe conditions, and it will impact our ability to continue to have construction seen as an essential service. So I wanted to run through, and I should also mention Adam. I have the manager of building safety services here with me, Adam Gagne. So Adam is going to be here later to support me in any questions that might come up after, but I welcome Adam as well. So I wanted to just talk about what we're doing at the city to make sure that we're supporting the industry and making sure that inspections can continue so we can keep construction going. So for commercial and multifamily sites, there's no changes other than the fact that when the inspector arrives, he will be, asking some questions to ensure that all the precautions have been taken and that the site meets the safety protocols that have been in place for COVID-19. I would also ask that if you could encourage your workers at the site to really distance themselves when our inspectors arrive. We want our inspectors to feel really safe and secure. We want them to feel confident in continuing their work so that we can continue to support your industry. So if you can ask, your workers maybe even to step into their truck or to take a break while our inspectors are on site, it'll just make them feel that much more comfortable and that much more confident in continuing their work. We have made some changes to our occupied residential inspections, and this is a huge leap forward for our industry. We've introduced video inspections, and this is something that, we were talking about over the last few months. We've been talking about it, and it was on our roadmap to launch probably over the next couple of years. But because of this emergency situation and because of the concern we have with our inspectors going into residential occupied sites, we've introduced a new way to do residential occupied inspections, and that is through a video inspection. So we launched this last Tuesday, and so far we've seen I think we did like 100 on Tuesday, and the volume is growing. So we have mandated it for our occupied residential sites. unless there's an emergency situation or it's an external inspection or a final occupancy. So we don't want to hold up any final occupancies. So we are allowing our inspectors to go into the site for final occupancy and do those inspections as long as the COVID-19 screening have been met and the safety protocols are in place. So, I just want to, let you guys know that the city is here to support your industry. We are looking at different ways to support you. We're looking at ways to expedite permit so that we can get those out as quickly as possible in case there is any concern with the stoppage. We want to make sure we start every project as quick as we can. We are seeing our inspection volume is down by about 20%, but it's still going pretty strong considering the situation we're in. Permit volume, we have seen an increase in a slight increase in single construction permits by about 1% year over year for the last 2 weeks of March. Residential improvement projects have been up, so that's been good news. Commercial projects, we have seen a decrease by about 20 to 25% over the last 2 weeks, but we're still getting permits in. So the industry is still going, albeit down from where we were this time last year. But, we really are here to help. And if you guys have any suggestions on what we can do as a city to help you to continue your work, we are all ears, because we want to be your partner and make sure that we are successful in the challenging weeks and months to come. So I think that's it for my presentation, but glad to take any questions that there might be. So pass it over to you, Brian.
Thanks very much, Brenda. Really appreciate you taking time out this morning to speak to us. And I also want to thank you and all your colleagues at the city for all the things that you're doing in the background to help the construction and real estate industries stay as an essential service. So really grateful for that. We have a number of questions here. So I'm just going to do my best to run through them. You can see them on the chat line or the chat piece for the most part. There's a few that came in private. Some are asking for information on how to get hand sanitizer. And there was some shared earlier from Prominent Homes about Minas breweries producing it instead of beer. And a step up next week. We'll post that on our website. There were a number of questions about this meeting and the recording. We'll post that on the BILD website as soon as it's available. Just ask your patience on that, because it's memory heavy and it takes a little bit of time to get that up on the site. So let me just find the first question here. A question from Tim Chadden at Hopewell Residential. With Safety Tech system, is there a way to automate the download of forms submitted or email a PDF copy to the company server or email address? Craig, can you take that one?
Yep. So in the actual full system, we can. As far as the COVID-19, that's definitely something I can see if we can add in to for right now. But yes, it does come in the feature functionality of the existing system.
Thanks, Craig. And if anybody needs to, they can reach out to you at the contact information you shared on your screen there as well, correct? And if I'm not mistaken, we've posted that on the website. So thanks for that.
Yeah, and anybody
Dr. Wheeler,
email as well.
Sorry, go ahead, Craig.
And anyone who wants to contact me directly via email, I'd be more than happy to answer any questions.
Awesome. Thanks a lot, Craig.
Yep.
Dr. Wheeler, a question for you. Has there been any investigation on whether COVID-19 can be transmitted by an insect bite? And I know that seems like a kind of a pessimistic question, but I guess we'd all like to see weather warm enough that there would be insects out there. Perhaps you can try that question, Dr. Wheeler. Dr. Wheeler, are you still there? Is your microphone muted?
How about I unmute my microphone? What do you think?
There we go.
I've seen nothing on that, nothing about transmission by insects. The most I've seen has been concern about possible transmission by pets, dogs, cats, and so on. And they're tending to downplay that as an issue. I guess the possibility is you could be petting your your cat or your dog, or an insect could land on you and get some virus on it and then transfer it onto someone else, like we suppose the mosquitoes transmit Nile virus. But I think that's probably a very remote route, and I haven't seen any work done on it.
Thank you, Dr. Wheeler. From Marion at Harco Developments, what should companies do if we can't get any N95 masks or other kind of mask? Are we able to ask people to make and wear their own? Moreover, should employees be expected to wear masks to work, struggling to when they have to work in a kind of in closer proximity to others? Dr. Wheeler, I think that's another question for you. You kind of addressed it in your presentation, but just maybe take a crack at that one, if you would, please.
Well, I don't know of any regulation that says you cannot wear a homemade mask. And I would say, yes, make them if you cannot get hold of N95s, but just be aware of the shortcomings of homemade masks. And you can feel when you breathe through them that a lot of your exhaled air and inhaled air goes indeed through the fabric of that homemade mask. But you will know that a lot of it also goes around the outside, and that's not filtered. So it will provide you with partial protection, and that's better than nothing. And I can't see any law against using it. I think you should. And I would look online at the various different models that have been proposed, because there's tons of them out there.
Thanks, Dr. Wheeler. I think this is another question, or maybe just a comment from Amanda at Wilco Contractors. We have included in a cleaning and sanitizing, I think it's a work procedure there, not yet released to staff yet, to spray work gloves with Lysol disinfectant spray throughout the day. We are also recommending spraying boots at the end of the day with the same spray and keeping them out of the house if possible. And I've actually heard that healthcare workers, as they go home to their families, are making sure their clothing doesn't enter the house. Can you just maybe give us a comment on that protocol, Dr. Wheeler?
Sure. It's what I would do if I thought that my gloves or boots might be contaminated, to be honest with you. But how do you know they are contaminated? I mean, you don't want to go doing a whole bunch of unnecessary things if it truly is unnecessary, and if you haven't been in a situation where you might really get much exposure to hantavirus. But certainly if there's any doubt and you've got boots that you can spray and decontaminate that way, I would do it. If they're leather boots, I mean, you could spray and the stuff's going to absorb in, it's going to kill a whole bunch of viruses on the surface. You probably won't get to all nooks and crannies. If you try to, you'll probably destroy your boots. So you may only want to give them a light spray, but even that would presumably do something. And the same for the gloves. I mentioned previously that I have some leather gloves that I sprayed with fantastic cleaner. Now, it should destroy the viruses. Whether it's going to get to every virus that's kind of in the pores of the glove material, well, I doubt. But at least you're trying to do something. You must mitigate it to some extent.
Thanks, Dr. Wheeler. This is from Melanie at Shane Homes, and I think this one is for me. It says, you mentioned the industry is at risk if we aren't aligned. How can we support each other in sharing how we are handling safety initiative and communicate strategies to ensure those who don't have the expertise or resources are aligned with what others are doing to keep industry going? So the first thing is our website. The public section of our website is available to anyone who wants to access the numerous resources that we are accumulating for people to reference. We also are heavily collaborating with the Calgary Construction Association, who has put together a very detailed document. I think we're on the 3rd revision of that, and that is shared on our website. And we're happy for all of you on the call this morning to share that news far and wide and point everyone to our website and the other resources that are available. We have to spread the news as best and as quickly as we are able, and we're certainly endeavoring to do that. The next question that we have there, and I'm just getting a time. Sorry, and one other thing here, I just got a text reminding me of this. We're also starting to share these tips on social media, so if you know where the BILD handle is on that, and I may have to ask my friend Lauren to chime in because she knows how to access social media way better than someone as old as me. I think she's typing it in as we speak. The next question is regarding portable toilets in new communities. How can we ensure washrooms remain sanitized and clean? We have increased cleaning services and have provided sanitizer, but it is getting stolen from sites. What is our liability if and when sanitizer is removed and toilet paper is stolen? I don't know if anyone on the call is able to answer that, and that's from Nicole. I don't know if anyone on the call is able to answer that question. I think you just have to do the best you can. And I think, Ernest, you might want to just chime in on that question as well.
What I would recommend is, as follows your policies and procedures for your trades and employees, that everyone is involved in sanitizing the porta potties. One of the things that Dr. Wheeler talked about is the fecal opportunity of spreading this COVID-19. So I would make it part of our procedures that everyone has a responsibility. And so if stuff gets stolen, that is difficult. But it is a service that is being provided. And if you get everyone as part of your pre-qualifications to recognize that that's a shared responsibility, I think that would cover a lot of things.
Thanks, Ernest. From Matt. Matt is asking if we know of a procedure to complete a temperature reading. Can you break social distancing to do this check? If yes, what is the proper PPE required to do this? And Craig, I'm going to toss that one to you to take the first crack at, if you will, given that you are kind of deploying a bit of a checklist and how you see that rolling out.
Yeah, sure, Brian. I mean, as far as the PPE, I think you have to do, whatever is mandated right now to get close to somebody. I know that one of our questions is like, do you have a fever today on it? Because I think that is one of the kind of the trigger points of it. So yeah, I think, doing what you can, wearing a mask. And I know there's a couple of companies actually using thermal imaging as well at the front of their sites. I'm not sure like what the cost of that is or if that's something free that they're allowing, but can check on internal temperatures as well.
Thanks, Craig. The other thing I might just pile onto your answer there is it's the form that Craig's safety tech is providing, and Craig is so kindly providing through his app for free. It's a screening for a fitness for work test in many respects, and that should be done at home. And so before anybody's getting up and going to work, you should be taking your temperature. I know those of us here at our household are regularly taking our temperature inside the household before we depart for anything, and so far so good on that front for us. Karen, a question from Karen. Has there been any discussion regarding protocol for air tightness testing? We are planning to ask for either an empty unit or I'm not sure I'm going to get this right. We'll test through pressurization, which will only produce slightly worse results. I think that's for you, Dr. Wheeler. And you might need to unmute your.
Didn't hear all of that. Sorry. Can you just repeat that quickly?
It's a question about, do you have any information that you might be able to forward to Lauren for posting on our website regarding air tightness testing protocols? And Karen, if that didn't get it, just resubmit your question.
I'm not sure what you mean by air tightness.
For masks, I believe, is where the question's going.
Oh, we're looking at the seal.
Yeah.
Okay, seal around the face. Yeah, sure. I could certainly send some info. I just would need her address, that's all.
Okay, and Karen, if you want to just forward that, you feel welcome to do it in a private message. Oh, sorry, Karen's question, she corrected it. No, home air tightness testing, enter guide. I'm not sure that's one Dr. Wheeler can answer. Why don't we take that one offline and we'll try to get back to you on that, Karen. And if you need to, you can reach out directly to us. Andy from Eco Electrical is just talking about hand sanitizer. Again, Justin wants to know about regarding ventilation as a form of control. Would it be appropriate and effective to ventilate the home before prior work? And if so, what would be an adequate duration for that ventilation?
Well, I guess if you ventilate prior to you going in there, that would remove airborne virus that might have been present due to previous occupancy. But I was thinking of ventilating it while you're in there because there may be nothing left over from other people, depending on how long ago they were in the house. If they were in the house a couple of hours before you doing work and you go in there, then sure, ventilate. And how much ventilation of the house? I would say if you did, let's say 5 air changes, which means you exchange the volume of the house 5 times with the outside air. And that would, how long it would take you to do that would depend on the capacity of the air moving devices, the fans that you were using. Difficult to really quantitative other than like that.
That might be one we can follow up on for the folks who are working in kind of the closed in spaces there. And that's
Right.
another one we might take offline and do a bit of research on as well.
Yeah.
I think we're kind of getting to the end here of the questions so far. Oh, sorry, Ernest, did you want to chime in there?
Yeah, the only thing that I think we should talk about is public interaction with our work sites. That's one thing we haven't touched base on. A lot of companies have to show their places or their buildings and such, so there should be very strict protocols on that. And if you can do that virtually, that would eliminate any opportunity for community transmission as well. Just wanted to throw that out there because a lot of show homes are now doing by appointment only. There should be disinfected between that, or there should be a virtual opportunity. Just wanted to throw that out there. Thank you.
Thanks, Ernest. And I think that's kind of one of the last questions here. Just we're taking the temperatures of customers coming into the show home. Can we break social distancing to do that? Ernest, I don't know if you want to chime in on that one.
It's really a difficult situation. We don't know we know our workers. Do we know the public? There's going to have to be really stringent protocols on social distancing, all of that stuff. And if you want to take those temperatures part of the procedures, that needs to be clearly stated up front in order to minimize the negative impact of that to a person who wants to come and see your place or do business with you. So yes, you can, of course you can. But make sure that that's done in a positive manner rather than negative. Otherwise, it's going to impact your business. So just thought I'd throw that out there. Thank you.
Ernest, just wondering maybe if a way to think about that is it's the customers, try to place the onus on the customer to take their own temperature. There's a bunch of kind of digital devices. I don't know if there's been a run on those, but maybe that could be on the counter. They take their temperature. You can look at it from an appropriate social distance and then use whatever sanitizing equipment to sanitize it.
Absolutely. Absolutely, because the place has to be clean from the person that just came in for the next person and so on and so on. So yes, there's going to have to be some stringent protocols in place for that.
Okay, and I think some are seeing some notes about Canadian Tire and availability of sanitizer there. And I think one last one here, we're kind of at that magic moment when we need to kind of close it down. The last one looks like, how does the coronavirus survive in UV light? Is that an effective method of disinfecting? And Dr. Wheeler, I'm going to let you back clean up on the questions here.
Okay, I don't know for sure, but I would think so. Certainly, outside sunlight is not kind to coronavirus, and generally ultraviolet is bad for them. But I don't know if anyone's done these studies to show how much coronavirus is killed by what intensity and what duration of ultraviolet light, but you would think it would be have some effectiveness.
Thanks, Dr. Wheeler. I think we're pretty much at time, and I see that it's clear that while we still have a strong group hanging in, a number have left us to get to their days. Just going to wrap it up, and I think Melanie from Shane Holmes really kind of put this in context again. And as we started out saying, so far, our industry, the construction industry and the real estate industry, has been able to enjoy the privilege of being deemed an essential service and essential business. We need to continually earn that privilege. And the way we continually earn that privilege is by genuinely ensuring that all of the aspects of our operations that could have any impact on public or worker safety are dealt with. And so that needs to be job one. And only after that job is addressed and completed can we actually enter into the construction and real estate business. If we perform in that way, as much as it's possible, I think we'll be able to stay in business. And just the fact that all of you reached out here this morning and participated so well in this call is real evidence of our industry's commitment to that. So thank you very much for that. We very much wish that you stay safe. We will post on social media, and I'm told the social media handles are at BuildCR on Instagram and Twitter. We're also on Facebook and LinkedIn. We will be posting connections to these materials there. Share it far and wide. It's important that everyone that's in the industry have access to this. And we, again, thank you for your attendance this morning and ask you to be safe out there. And last, a shout out again to the City of Calgary for such great support of our industry. And we look forward to continuing to collaborate with you to keep things going for all of us. Have a great day, everyone, and please be safe.